you.
In your Health Watch this morning, diabetic macular edema is a leading cause of blindness, and treating it requires multiple doctor's visits and injections into the eye. Now, a new implant, which is the size of a grain of rice, is saving vision and time.
Yeah, it's amazing. One implant can treat patients for up to 3 years, helping stop and in some cases reverse the damage. Tess Raffles has the story.
All right, come on forward there.
These days for James Schilling, a trip to the eye doctor requires little more than having his eyes dilated. A far cry from just a few years ago.
He gave me a battery of eye injections.
Shots in his eyes to control diabetic macular edema.
The standard of care right now is to give injections every 4 weeks.
Macular edema is caused when the blood vessels in the eye leak, causing the macula at the back of the eye to swell like a sponge.
That's one of the leading causes of blindness.
Dr. Praveen Dugal with Retinal Consultants of Arizona says those shots can help stop the leaking, but many patients end up missing treatments, unable to keep up with visits.
You can imagine the treatment burden of somebody who is working and having to take off time, be in my office, and sacrifice half a day or even a whole day every 4 weeks to get this treatment.
Schilling says just getting a ride was often a problem until Dr. Dugal suggested something more permanent. It's called an Iluvien implant.
This is a very, very clever steroid release device.
Through a very small needle, the doctor injects a miniature tube into the eye. It's smaller than a grain of rice and filled with steroids.
Patients don't notice it. It floats to the bottom. Only the ends are exposed. So what happens is that the steroids leak out from the ends, and they leak out in a very predictable fashion.
The steroids release very slowly over a 3-year period, helping stop the leakage, saving time, money, and vision for patients like Schilling.
The less times you have to go in for treatment, the better.
That makes a lot of sense. Tess, thank you. That implant can sometimes actually reverse damage if it's caught early enough.
Yeah, and doctors put in a second implant after 3 years if needed, but one implant is generally enough to stop further damage.